This exercise is called functional IR, internal rotation, and functional ER, external rotation. So you're going to have a high anchor for your bands, and for functional internal rotation, you're going to have is pulling down, making sure that their elbow stays at a pivot point. We'll do 3 sets of 15. And this exercise is called functional external rotation. So they'll have a low anchor for this exercise. Again, shoulder at 90 degrees and elbow at 90 degrees, and just pulling up. 3 sets of 15. This exercise is called lat pull downs. So you're going to grab the lat bar, which is attached just with this Velcro to the side of the machine. And you're going to come over here and hook it in to the machine. And you want to make sure that whenever you're adjusting the weight, you hold the bar up, because if not, it will fall down on the patient's head like that, because the bar is heavier than the machine. Then you'll just have them grab shoulder width apart, keeping their arms as straight as possible and pulling straight down. 3 sets of 15. Okay. This exercise is called military press. So you're going to want to grab 2 same weighted dumbbells and have them place the weights above their shoulders and just be pressing straight up above their head. 3 sets of 15.
All right, for the military press, sometimes we want our patients to be in safe position because we don't want them out here like this. So we'll just have them right in front, and then same thing, just going up and down, 3 sets of 15. All right, this exercise is called ball rolls, and there's 2 different ways to do it. There's T's and circles. So what you'll have them do is they'll get this ball and come over to a wall, and they'll place the ball on the wall and kind of go, for the T's they go up, down, side, side. They'll do 3 sets of 30 seconds, just doing that same motion over and over again. Then for the circles, they go like this, 3 times for 30 seconds. All right, this exercise is called rhythmic stabilization. So we're gonna have the patient do is lay down on a table, and they'll lift up the arm that we're treating, and we'll also have them close their eyes. And then what we'll do is kind of push their arm around like this, and the patient is going to resist the movement. So you don't want them having their arm go all over the place, and you don't want to hurt them, but kind of be a little forceful to get them to work. And you'll do this 3 times for 30 seconds. All right, this exercise is called 6-way shoulder isometrics. So what you'll have the patient do is get a towel that they can use to put against the wall while they're doing this. And there's the 6 different directions. So there's abduction, where they're pushing out this way against the wall. And then you'll also have adduction, where they're pushing this way against the wall. And then they have external rotation, where they place the towel more behind their arm and they're trying to just rotate that way. And internal rotation, same thing, just pushing in this way. And then they have extension, pushing back against the wall, and last, flexion, pushing forward against the wall. And it's 10 times for 10 seconds each way. All right, this is called the genie stretch. So you'll have the patient cross their arm in front of them that they're stretching, and you'll have them push their arm slightly downward at an angle like this, holding for 10 seconds, 10 times. All right, this is called shoulder depressions. And there's 2 ways you can have the patient do this. Either have them just do the opposite of a shrug, just bring their shoulders down and holding it for a few seconds. Or you can have them push off of the table like this, bringing their shoulders down.
This exercise is called apple pickers. So the patient will have a low anchored band. You'll have them reach up and rotate like they're grabbing an apple and come back down. And they'll repeat this 3 sets of 15. Their elbow at 90, their shoulder at 90, and their elbow at 90.
And you'll tell them to resist the movements that you're gonna make them do.